joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us, and we'd like to wish a wonderful first day of school to everyone who's heading back to the classroom today. We're pleased to have with us today the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, Medical Officer of Health for the Middlesex-London Health Unit, Dr. Mackie, and Dr. Adam Dukelow, Chief Medical Officer at London Health Sciences Centre, with us today. We'd like to welcome the media who are in attendance and invite them to submit their questions using the question and answer form here on Microsoft Teams. Please be sure to include your name, media outlet, and to whom your question is addressed. And last but not least, we'd like to welcome those of you tuning in on Rogers Television, Facebook page, and YouTube channel, those watching on the CTV London website, and those listening on News Talk 1290 CJVK. Without further ado, we'll get to the opening statement, and we'll start with London Mayor Ed Holder. Mayor Holder.
Thanks very much, and good afternoon, everyone. Look, I hope everyone enjoyed the tremendous long weekend we've had, and I'd like to wish a happy first day back to school for tens of thousands of elementary and high school age students across the region. And of course, those coming back from Western and Fanshawe, we welcome you to our community. I know a return to in-class learning has been a long time coming, not only for kids, but for parents. And I also know everyone involved, including teachers and education staff, will be doing all they can to ensure a safe and fun experience for all. But let me also say thank you. Thank you to teachers, to staff, to parents, and to the students for doing your part to keep us all safe. There's no doubt about it. These are trying and uncertain times. We feel nervous, frustrated, even angry. But lately, some of that anger has ventured into downright ugly and frankly unacceptable territory. By now, we've all seen the news coverage of Prime Minister Trudeau's visit to London yesterday, when he was greeted by an angry mob of anti-vax protesters. Look, protests are one thing, but when the Prime Minister, or anybody for that matter, is pelted with rocks and gravel, it's absolutely appalling behavior. This goes beyond partisanship or a simple difference of opinion. It also goes beyond elected officials. In recent days, we've seen healthcare workers in London and elsewhere accosted. We've witnessed protests outside hospitals, which impacts healthcare to all. Seriously, what's going on? Whether it's the Prime Minister, healthcare workers, or someone working the cash at Tim Hortons, no one deserves that kind of behavior and treatment. And the rest of us should not accept that kind of behavior. To be clear, protests are fine and part of our democracy. However, what we've seen in recent days goes well beyond, and we need to be better than that, regardless of how anyone may feel about a particular issue. We've seen what happens elsewhere in the world, including the US, when these types of actions go unchecked and unchallenged. Enough is enough. So on another topic, as the Deputy Mayor outlined last week, our own vaccination policy for City of London employees is being reworked and strengthened in light of updated direction provided by the provincial government. I can share with you that the updated and revised policy is still being finalized and is scheduled to be publicly released later this week. So that's all for me at this point. Over to you, Warden Cathy, please.
Great. Well, thank you so much for that, Mayor Ed. And it's great to be with everybody on this Tuesday afternoon in September. And all around the county and the city, there were cheers of delight and celebration, and they were heard from children and parents alike. It seems that families have been waiting for this day, the return to in-school learning, and it's been a long time coming. I am well beyond first day pictures, but I have to admit, I have enjoyed seeing the many shared pictures of kiddies so excited to return to school. And I wish everyone much success in the coming year. It is safe to say that this will be a year like none other. And I know in speaking with friends, today the hope is that in-person learning will continue for the year. And how do we ensure that that happens? By following and doing what has been asked of us. Over the weekend, I took some time to look back on past messages I have shared through this forum and at County Council or at my Lucan Biddulph Council meetings. And I was struck by some messaging that I shared and that was a common theme in the early days of the pandemic and into the summer of 2020. And it was shared by many leaders from all levels of government from across the country. And that was equating doing our part during the pandemic to it being a part of our duty as a citizen to our municipality, province, and yes, country. There is no doubt that has been stated on numerous occasions right here during the last month or so, we are in the fourth wave. In our area, we are managing, but as we know, that can change very quickly. And we all still need to do our part. We are at war against COVID-19, and we have been for quite some time, and that war is not yet over. And during a war, we as citizens are asked to play a role. If you have not gotten vaccinated or hesitant to get a second dose, please think of getting the vaccine as your duty in time of war. It seems that many of the positive cases in our region are in the unvaccinated and in the younger demographic. And I would ask those that have not been vaccinated in their 20s to think of the thousands of young men who went to war as a duty to their country. You cannot tell me that they wanted to go or that they willingly went off, but they did so with a sense of the role that they had because they had the privilege of being a citizen in Middlesex, in London, in Ontario, in Canada. And I would ask you to get your vaccine with that mindset. In Middlesex-London, our vaccination rates are incredibly encouraging. But with children under the age of 12 still unable to receive a vaccine, if you are part of that demographic able to get a vaccine, please do so. Because that vaccine will, in the end, help protect those that cannot get vaccinated. Getting vaccinated will help ensure that kids that went off to school today will be able to continue to have an in-class and in-person learning experience in the year to come. Over to you, Dr. Mackie.
Thanks very much, Madam Warden and Mr. Mayor. So we did have another fatality over the weekend. Cases overall have leveled off quite nicely locally. The death was again in someone unvaccinated. This now marks over 2 months where we have not had any deaths in anyone who is double vaccinated. A really strong indicator that the vaccine campaign is working. We continue to reach new heights. Over 84% of people have had first doses. We're approaching 80% for second doses in the region. We did see a big uptake last week after vaccine passports were announced. On Thursday, we had a 50% increase, which was sustained through the week. On Sunday, we actually had double the number of people vaccinated in the mass clinics as we had the previous week. And over half of those new vaccinations are among people who are first dose. So a great sign that the policy move to require vaccination in certain settings is having the desired effect of increasing vaccination uptake, which will make all of us safer. I did mention cases have leveled off a bit. We saw a big bump with the 2 outbreaks at the 2 bars about a month ago now, and that has settled. We've had fairly flat case counts since then. However, learning more and more about very problematic behavior, we're hearing about student parties, we're hearing about planning for potential, FOCO sorts of events. This is definitely on the radar, definitely a big concern from a COVID perspective. Thank you to all of the businesses that reached out after we requested businesses and recommended that they implement mandatory vaccination policies. We've had lots of people reaching out to say thank you for the guidance documents that we provided and spoke earlier today with the Chamber of Commerce. That was actually Beth, who you all know well, and Dr. Summers had a good conversation, and that is really moving in the right direction. So again, big thanks to the business community and all of your support. We know you want to keep businesses open, so do we. Let's do this together, and that means getting vaccinated. That's it for me for now. Happy to take any questions later, but we do have Dr. Dukelow here from LHSC.
Thank you, Mayor Holder, Warden Burghardt-Jesson, and Dr. Mackie, and thank you for having me here today to provide an update on the COVID situation at London Health Sciences Centre. As of this morning, we're caring for 11 COVID-19 positive inpatients, with 5 or fewer in critical care. I'll begin today by sharing that we are prepared and ready to support care for children and families in our community as students return to the classroom today for in-person learning. As mentioned earlier, what an exciting time for students, teachers, parents, and in general for our community as we head into a new school year, hopefully one that stays in the classroom. The Carling Assessment Center has enough capacity to support current COVID-19 testing needs. We are also prepared to modify our capacity as testing demands change and continue to work with our partners at Ontario Health West on plans to ensure the assessment needs of our community can be met. As well, we want to remind families that we are here for you. Our pediatric emergency department is open 24/7 for emergent and less acute concerns can call through the virtual urgent care clinic, which is available 7 days a week in the evenings. As per the provincial direction, any LHC staff member, physician, researcher, learner, contractor, or volunteer who has not yet provided proof of full vaccination against COVID-19 has begun the process of regular antigen testing as of this morning. We have also announced a mandatory vaccination policy. This is largely a temporary measure, that being the testing is a temporary measure that will provide it to those while they're waiting to get vaccinated or getting vaccinated over the next number of weeks. We are standing with fellow healthcare organizations across the Southwest and Ontario on mandatory vaccination. Later this fall, patients coming to LHSC will be able to take comfort in knowing that their care team has been fully vaccinated. We strongly believe that adding vaccination to our many other protective measures is the right thing to do to protect our staff, our physicians, and most importantly, our patients. Thank you to our media partners, and for all those of you that tuned in, are taking the time to tune in today. I look forward to your questions.
Thank you, Dr. Dukelow, and to all of you for your opening remarks. We do have some questions in queue, so we'll get right to them. The first one is for you, Dr. Mackie, and it's from Andrew Graham at Global News 980 CFPL. Dr. Mackie, can you provide an update on the investigation into whether there was a workplace connection involved in the case of a woman in her early 30s who died last week?
Yes, thank you. So it looks like that case was connected with a workplace outbreak. We had a complex multi-site outbreak with Dukelow Holdings earlier this summer. There was an outbreak on a job work site as well as in the office. Unfortunately, many people in that setting were not vaccinated. This individual didn't work in that facility, but was connected through family connections to that outbreak. And there may have actually been another death that was linked through secondhand contact through that outbreak as well. So again, just a really important reminder how important it is to be vaccinated, how important it is to follow protocols, workplace safety protocols in office settings, in job work sites. We know, there's sometimes an attitude that, I'm young, I'm healthy, I'm tough, I can take it, I don't need to wear a mask, I don't need to get vaccinated. You do need to get vaccinated because it can happen to you or it can happen to somebody you love.
Thank you very much, Dr. Mackie. Our next question is again from Andrew Graham, Global News Radio 980 CFPL, and it's for you, Dr. Dukelow. LHSC's COVID-19 updates page now lists pediatric critical care cases. Why was this added? And is this something LHSC is anticipating?
Thank you very much for the question. So we've all seen the impact of the Delta variant on the unvaccinated, especially those, or including those that are less than 12 around the world and are unable to get a vaccine at this point in time. We as an organization have also had many inquiries from media and otherwise about the number of children with COVID who we are caring for. So we wanted to be proactive by publishing these numbers. We'll take this as an opportunity to echo some of the earlier comments, though, that anyone who can get vaccinated absolutely needs to do so. Even if it's not for themselves, do it for those in our society that can't get vaccinated or have less of a response to the vaccine.
Thank you very much, Dr. Dukelow. Our next question is for you, Dr. Mackie. Again, Andrew Graham, Global News Radio 980 CFPL. Has the MLHU seen an increase in first doses administered since the province announced last Wednesday that that it would be implementing a vaccine certificate system?
Thanks for the question, Andrew. Big jump in first doses for sure. I did mention we've had a 50% increase overall in vaccinations since the announcement, but that jump is higher in people who are first-time doses. It's more like 55, 60%. So that's really tremendous. People making a good decision. I know a lot of people, were just waiting for the right reason to do it, and not necessarily opposed, but just busy, other things going on in their lives. This policy change helps focus people's minds. It's a really important change, and really grateful to everyone who's making that decision to get the shot.
Great, thank you so much. Our next question again is for you, Dr. Mackie, and it's from Ashley Gouveas at the Western Gazette. Dr. Mackie, Western's O Week started last night. Social distancing was scarce, and by the end of the night, most students did not have their masks on during the outdoor concerts. How does the MLHU feel about the safety measures that are in place?
Well, I appreciate the question, Ashley. I think that, I think that those organizations that can are doing their best, and it's really up to young people to take up the safety precautions or not. We've seen large outbreaks among almost entirely vaccinated populations. There was that case where you had over 1,000 outbreaks with one weekend outdoor gathering at a music sort of festival in the Netherlands. In that situation, you had people requiring vaccine passports, although the passports kind of had holes in them. If you'd had COVID before, you got a passport. If you just had the vaccine, earlier that same day, you still got the passport. So regardless, we know that the majority of students are vaccinated, but not all. So you've got vaccinated and unvaccinated people mixing. And if you have those sort of large gatherings, even outdoors, we will see tremendous spread. So I'm concerned about that. I'm very concerned. We know, with some certainty that sort of activity will cause an increase in our numbers. So, I mean, I don't know what more to say on that. I think young people know the right thing to do, and it's a demographic that takes risks. I just hope they're vaccinated and being as careful as they can.
Thank you very much, Dr. Mackie. Our next question comes from Travis Donnelly at the CBC London. And I believe this is something that Mayor Holder, Warden Cathy, Burghardt-Jesson, and Dr. Mackie could all give their thoughts on. So maybe we'll start with you, Dr. Mackie, and then if Mayor Holder or Warden Cathy have thoughts, then they can add them. So the mayor of the township of Warwick, Jackie Rombouts, tweeted yesterday that she will refuse the province's vaccine passport and will not patron any business that will not welcome everyone. How do you respond to public leaders pushing back against health orders like this? So we'll start with you, Dr. Mackie.
Well, I guess it's just another reminder to be grateful for the great leaders that we have in this community. We have tremendous leadership from our mayor, from our warden, from councils at many levels. The provincial government takes this seriously and has made the policy change around vaccine passports. We really are fortunate to have strong leadership here that gets what's going on and understands what needs to happen to address it. It's disappointing that others don't, but I guess it's fortunate that this is a smaller community and hopefully not many people will be affected by this bad decision.
Thank you very much. Mayor Holder or Warden Cathy, do either of you have anything to add?
I have a Cape Breton mother. I have many opinions, so let me offer this if I can. With the deepest respect to the mayor of Warwick, I will absolutely accept the province's vaccine passport and encourage all Londoners to get their passport. Look, we've all been working way too hard. With 80% plus having had their first shot, well over 70% their second in London. People get it. The majority of people get it. And frankly, we do not want to put our children, our seniors, our friends and our colleagues at risk by going into businesses that are that don't care whether or not you've had your passport, or your vaccines. You know, it was kind of bizarre. I read the other day about a business that said they will only hire people who have had no vaccine shots. Are they nuts? I mean, this is so ridiculous. And the science is so clear on this that, frankly, anyone that doesn't view this, I mean, isn't it great we live in a country where you can make your own decision? But decisions are going to be made for us in some ways, because what the vaccine passport does is it makes it an easier process for businesses to be able to screen patrons, employees, all of that. And I think that's prudent if we want to get through this and avoid avoid the disruption, frankly, that some people have forgotten. It wasn't all that long ago with that first wave and that second wave and that third wave and the impacts that it's had. So you know what? I don't forget. And the people on this call do not forget. So from my standpoint, I will concur with Dr. Mackie. The leadership on this call, what I am truly grateful for is how they stand tall when it matters to be counted and to make a difference for the positive outcomes, even to help support those who, frankly, choose to not get it or just don't get it.
Well, I did not have a Cape Breton mother, but I had a very opinionated father who taught me to have opinions as well. And I mean, there's really not much else I can offer from what Mayor Holder has shared and from what Dr. Mackie has shared. But I will offer this in that, and if I'm going to be 100% honest, and I think as a leader, you have to be. I've had discussions with Dr. Mackie over the summer about the route that the province was headed, and I have struggled with what a passport means. There's no question. But I always come back to, we have a duty as citizens to get through this. And how are we going to get through this? Sometimes there are things that are going to be asked of us that we have to do that maybe we might be uncomfortable with. But we can debate it, we can discuss it. But in the end, we have to do what's asked of us for the privilege, as I said earlier, of being citizens of our country. And if we don't do this, we're never, ever going to get out of this. It's only going to perpetuate and keep going on and on. And in my mind, I'm happy to have the passport. I mean, for crying out loud, I have the proof. You get the proof. So what's the difference then with the passport? And we have to do what we have to do to get out of this situation that we're in.
Thank you very much to all of you for your thoughts. Our next question is for you, Dr. Mackie, and it's from Ashley Goveas at the Western Gazette. Dr. Mackie, does the MLHU have any messages for Western students as they return to in-person learning?
Well, I guess I would remind Western students that we have had deaths in young people in this very community. 2 of the handful of deaths in people under age 20 have been here in London. It can happen to you. It will happen to you or someone you love if you're not careful.
Thank you very much. Our next question is from Jane Sims, and it's something that Mayor Holder, you touched upon in your opening remarks, but Jane was hoping to get the thoughts of Dr. Mackie and Warden Cathy as well. So to Dr. Mackie and Warden Cathy, did any of you want to comment on the events yesterday at the Justin Trudeau campaign stop that involved protests from an anti-vax group?
Well, maybe I'll jump in first in that, I mean, I think, again, the mayor summed it up quite well. There is no place in politics for violence. And no matter who what party you represent, you are there for public service, and that should always be respected. And it is quite disheartening. It was quite disheartening to see this sort of behavior in our backyard. I am fine with having a debate. I'm fine with having a discussion. But when violence enters it, it's really a sad state that's where we're at. And, you know, you go back a year ago when our neighbors to the south were going through a emotional campaign, and we were all very quick to point fingers at behavior. And it's just very sad and disheartening to see that in our own backyard.
Yeah, maybe if I could just briefly add that, you know, we had some of these anti-vax demonstrations here. They have amounted to very little. You know, the more attention we give them, the more they will happen. So I would encourage our colleagues and partners in the media to look elsewhere for your stories.
Thank you very much for those comments. We do have one last question in queue, and it is for you, Dr. Mackie, from Jane Sims at the London Free Press. Dr. Mackie, can you give us the age and gender of the person who has died? And I believe you mentioned it in your opening remarks.
Yeah, so this was the woman in her 30s woman in her early 30s is what we've shared. It is the case from Friday that we were still reporting in the dashboard as of this morning.
Thank you so much. And that does leave us with no more questions in queue. So we will conclude today's virtual media briefing. A big thank you to all of you, Mayor Boulder, Warden Cathy, Dr. Mackie, and Dr. Dukelow for your attendance here today. We will be back on Thursday at 2 p.m. for our next virtual media briefing. And until then, take care.